talk about kidney stone treatment. Okay, kidney stones are normally, of course, made in the kidney, and normally they don't bother the patient when the stone is in the kidney because it's just there, it's not hurting anything. But it can grow from a very small size like that to something really big which can occupy the whole kidney. Now this picture shows what we call a staghorn stone because it kind of takes the impression of the collecting system here, and the whole kidney, interior of the kidney, is covered with these horrible looking stones. So when somebody has a stone like that, the treatment is going to be different. But let me talk about the common treatment for kidney stones. Typically a patient will come with a sudden onset of pain. Usually it happens because the stone that was in the kidneys decides to come out and drops into the tube. And there are three spots where the stone can get caught. One is right here, which is called the ureter to pelvic junction, which is this area, which is a narrow spot. Here's another narrow spot as this ureter crosses the blood vessel here. So it can get caught there or get caught here, and the last spot where it gets caught would be right at the opening where the urine comes into the bladder, which is right in this area. So depending on where the stone is, the treatment will be different. Let's say the stone is up here. This kind of a stone is hard to reach from the bladder. So a patient with a kidney stone in the upper ureter, which is up here, is usually treated by lithotripsy, or we can also do a laser treatment. Lithotripsy is where the patient will lie down on this is an older machine called a lithotripter, extracorporeal shockwave lithotripsy, or ESWL. This was the first machine that was made in Germany by Donier. It was a big tub. Everybody heard of this big tub with water in it, and you actually immerse the patient into the water using a cradle like this where the patient lies down, and this thing comes off the wall like that and drops the patient into this water bath. And you can see a generator. It's called a ellipsoid system right here. There's water here, and there's a spark plug, and the spark is generated and it creates a shock wave, and it goes up this way, and you can aim the shock wave at the stone. It could be a kidney stone or it could be a ureter stone. This area is very good for lithotripsy treatment because you can move the patient, back and forth, sideways, up and down, to get the stone right at that point. It's called point F2, point of focus 2. Okay, so once you get it there, you see the picture on the monitors, and you can actually monitor the treatment as the shock is being delivered. And the shock wave is delivered let's say at 120 times a minute, or you can do it at a lower pace. Anyway, each time the shock wave hits the stone, it can slowly start fracturing the stone into small pieces. So a stone like that will end up like a bunch of little fragments like that. And this chart is very good because this talks about all the different ways of removing the stone from the ureter. If you have a ureter stone, let's say up here, the best treatment, I think, is to shockwave it. But if it's not working and you want to do another treatment, you might want to choose one of these methods. You can use a grabbing forceps, which goes in through the bladder, up the ureter. It goes right up to the stone, and you can, under vision, using a ureteroscope, you can actually grab it and pull it all the way down carefully. Again, you got to be careful, because if you grab a big stone and try to pull it down the ureter past this narrow spot or past this narrow spot, there is a chance it could get caught and you won't be able to take it out. And it's happened before, where you actually have to leave the basket where it is and do another form of treatment to get that basket to release the stone. You can use a laser here, where you can use a laser fiber, take it up the ureteroscope all the way up to the stone, and step on the pedal, and when the laser makes contact with the stone, it just shatters it, and then you can take out the small pieces, either with a basket, or this is another treatment. It's called electrohydraulic lithotripsy, where this electrohydraulic probe will break up the stone. So these are different ways of breaking up stones. Here you see the ureter stone being hit with shock waves. It really literally breaks up a big stone into tiny pieces of different size fragments, and these fragments can either pass without any pain, or they can fragment here and then end up over here, and the patient will have some pain, but usually they're able to pass these tiny fragments. What happens if you have a stone that gets stuck? The smaller fragments may pass, but you may have a bigger fragment that'll get stuck, in which case you may have to go back in and use one of these methods to take it out. If the stone is too big, you don't want to try and grab it this way. You want to use a laser. If the stone is smaller and you know you can get it into this basket, you can take it out safely, then that's what I do. And this ureter opening into the bladder is pretty small, so we use a balloon dilator through the cystoscope. We go up in here, and the balloon dilator will make the opening bigger to a size, let's say about 6 millimeters, and any stone which is 3 to 4 or 5 millimeters can be taken out that way safely. And there's another thing we do. If a patient comes in with a severe kidney stone attack and he's having a lot of pain, and chances are he also has an infection, then what we do to relieve the infection and relieve the blockage, we put a little stent in here, and the stent goes in between the kidney and the bladder, bypassing the stone. So the stent will lie alongside the stone like that, and this way you buy some time. Number one, the infection gets better, the patient feels better, he doesn't have this pain from the stone and the high pressure. Patients ask me, why do I have pain off and on? The pain is really not from the stone itself, it is the pressure that backs up into the kidney. See, normally the inside of the kidney is pretty small here, and it's a closed system and the pressures are very low. But when the stone is blocking here, the pressures can build up to very high levels, and that's what causes the pain. Because it's a closed system, the pressure building up stretches the pain fibers and you get a lot of pain. And typically it will come from the flank area all the way down to the groin area. So when a patient presents like that and you don't have the opportunity to be able to take care of it all in one shot, some patients will decide, well, the doctor makes the decision to put a stent and wait. I would like to do that, especially if a patient has a fever and I know he has an infection. I want to decompress the kidney. Quite often when I put up a stent in here, you can't believe how dirty the urine looks in here. The urine should be pretty clear, but when I have a patient with an infection, once the stent goes in, it has an opening at the end and has small stones along, small openings along the stent that actually allows the urine to come either through the stent or around the stent. So once I put the stent up, sometimes it's amazing what kind of stuff comes out. It could be just pure pus, it could be looking like turbid urine, kind of like cloudy stuff coming from here down into the bladder. In which case I might leave a catheter here because I don't want that infection to come down here and stay in the bladder and still cause the patient pain and infection and all that. So I would decide to keep a catheter here so that the infection from here gets into the bladder and right away gets out of the bladder so that the patient can feel healthy again. I would usually keep them on antibiotics till the infection goes down and then bring them back to do a lithotripsy. Right now, the lithotripters we have do not use this water bath because they streamlined it now, so the patient just lies on a table and this water, instead of the water bath, there's a little bag of water, and it serves as a medium for the shockwave to go through. So that bag of water can be put under the patient and the shockwave can go from the outside through the medium of water into the body tissue and hit the stone and do that. Okay, so that's a quick rundown of kidney stones. So it can be up here, it can be down there, it can be down here, and we also sometimes have bladder stones here. In which case, if they're too big, then we use a laser fiber to break it up and take it out through the urethra. Sometimes the stones here are pretty small, so you can just use a grasping forceps. You can go through the urethra into the bladder, grab it and take it out. And stones that usually come out of the kidney land in the bladder, and the tubes get bigger from here down. So the problem is here, here, and here, but once it hits the bladder neck is bigger than the stone and the patient will pass the stone. Recently I saw a patient where he had stones here and it got stuck in the urethra and he couldn't pee. The tube was clogged, so we had to manipulate the stone and take it out of his urethra. And again, to tell you the anatomy, that's the kidney. This is called the ureter, U-R-E-T-E-R. That's the bladder, and here's the urethra, U-R-E-T-H-R-A. And that is the blood vessel called the aorta. That's the inferior vena cava. This supplies blood to the body's parts, inside the belly, this area, and it splits down into two and then goes down each leg to supply blood supply to the extremities, lower extremities. And this is the big vein that takes blood out of the lower extremities and pumps it up, or takes it back to the heart up here to be cleaned up, and then it comes back through here.